Okay, well, hello and welcome to today's session on foster youth mental health, current landscape and accessing Medi-Cal services. Next slide, please. My name is Carly Myers and my pronouns are she, her, hers, and I am a staff attorney with the National Health Law Program. I am joined today by Donna Paycow, pronouns she, her, hers, who is a senior policy associate at the National Center for Youth Law, and my colleague Nancy Lamb, pronouns she, her, hers, who is an Equal Justice Works Fellow with NHeLP. At this time, back one slide, just at this time, we'd also like to invite you to introduce yourself in the chat in the Whova app. We welcome you to add your name, pronouns, and also whether what interests you in this session today. Are you a youth, a family member, a provider, an advocate, or how do you otherwise relate to the topic of today's session? Next slide, please. While you take a moment to introduce yourself, I wanted to review a few housekeeping items. First, we ask that all attendees please remain on mute throughout today's presentation. We have reserved time at the end to answer any questions. The session is being recorded for you to reference later. The slides for today's presentation have been made available to you by our wonderful conference hosts, and today's webinar does have closed captioning, which you can enable at the bottom of your Zoom screen. Next slide, please. If you have any questions during the course of the session, please use the Q&A function in the Whova platform. My apologies for the picture on the screen showing the Zoom Q&A. We're still learning this new platform, but please direct all of your questions to the Q&A in the Whova platform, and we will do our best to answer those. If you have any technical issues during the course of the session, please send a direct message to one of the hosts, preferably Becky, who is our tech support on the back end today. Next slide, please. So before we dive into the substance of today's session, we also wanted to share some information about our organizations. So NHeLP is a national nonprofit law firm committed to improving healthcare access, equity, and quality for underserved individuals and families. We have a number of state and local partners, including disability rights advocates, poverty and legal aid advocates, and other health advocates across all U.S. states and territories. We also work closely with a number of national partners, including the National Center for Youth Law. We have offices in California, Washington, D.C., and North Carolina. And then our website and our social links are included here at the bottom of the slide. Next slide, please. NHeLP's mission is to protect and advance the health rights of low-income and underserved individuals to access quality health care. NHeLP advocates, educates, and litigates at the federal and state levels. We stand up for the rights of millions of people who struggle to access affordable quality health care. Next slide, please. All of NHeLP's work is informed by our equity stance. We firmly believe that health equity is achieved when a person's characteristics and circumstances, including race and ethnicity, sex, gender identity, sexual orientation, age, income, class, disability, health, immigration status, nationality, religious beliefs, language proficiency, or geographic location do not predict their health outcomes. Next slide, please. Every member of our staff defends the fundamental right of all individuals to health. Staff in every role strive to approach their work internally and externally with this equity lens. Our goal is to continuously examine the healthcare system and to advocate for health laws and policies that counteract structural barriers, institutional power dynamics, and examples of overt discrimination and implicit bias that create health inequity. To learn more about our equity stance and our organization, please visit the link at the bottom of the slide. Next slide, please. I am going to pass it to Donna, who will give some background about NCYL.
Thank you, Carly. The National Center for Youth Law is a national social justice organization dedicated to improving the lives of young people so that every child thrives and has a full and fair opportunity to achieve the future they envision for themselves. NCYL's purpose is to amplify youth power, dismantle racism and other structural inequities, and build just policies, practices, and culture that center youth through our work in the education, foster care, health, immigration, and youth justice systems. And you can find our website and our other social media platforms here at the bottom of the screen. And with that, I will hand it over back to Carly to go through today's roadmap.
Thanks, Donna. So we have a lot to get through today. We're very excited to have all you with us here. We're going to start off with an overview of the mental health landscape in California, discuss some of the foster youth specific data, as well as the impact that the COVID-19 pandemic has had on mental well-being. Then we're going to transition to how to access Medi-Cal mental health services, talking about the types of services available, how to qualify for services, and how to actually get services. And then finally, at the end of the session, we will have a live Q&A. Next slide, please. And then finally, before we dive into today's content, we also wanted to uplift a series of new resources for foster youth that NHeLP and NCYL have just released. These resources were developed in consultation with foster youth, and they include a guide to accessing Medi-Cal mental health services for current and former foster youth, a guide for all youth, and also a suite of infographics on reproductive and sexual health services for California foster youth. The resources are linked here in the slides and were also made available in the materials provided prior to this session. So we encourage you to review these and also share them widely to youth, to providers, to social workers, advocates, and anyone else you think may come in contact with foster youth. Next slide, please. So with that, let's get going. I'm going to pass it to Donna.
Thank you, Carly. So as Carly mentioned, we start today with an overview of the current mental health landscape to situate the importance of having accessible mental health services. Before we delve into specific trends and data in youth mental health, we'd like to frame how we envision mental health and what we mean when we refer to it. We see mental health as a state that includes our emotional, psychological, and social well-being. It affects how we think, how we feel, how we act. It can determine how we handle stress, relate to others, and make choices in life. And mental health is important throughout every stage of life, from childhood and adolescence through adulthood. As many of you may already know, even before the pandemic, youth nationwide were already experiencing a mental health crisis. In 2019, the Centers for Disease Control and Prevention released a report of 9 national data systems that identified that 1 in 5 US teenagers had experienced an episode of major depression. In that same year, more than a third of high school students reported persistently feeling sad or hopeless, showing an increase of 40% since 2009. And according to a study using data from the National Hospital Ambulatory Medical Care Survey, there was a 28% increase between 2011 and 2015 in adolescent psychiatric visits to the ER for reasons like depression, anxiety, and behavioral challenges. So before we examine how these trends in mental health have changed since the pandemic, it's important to note that there are many external and internal factors that can impact mental health, including some more at the macro level, such as access to healthcare, public policies, and neighborhood conditions, and some more at the individual level, such as income and economic status, availability of social support, race, and age. These factors are examples of what are known as social determinants of health, which are conditions in which people are born into, as well as live, play, and work in. And these factors are intrinsically tied to an individual's physical and mental health, and can impact their access to services, their ability to address their health needs, and their health outcomes overall. So let's re-examine these pre-pandemic mental health needs of young people at a more granular level, keeping in mind these social determinants of health. and how they can impact the mental health of certain groups and communities, and how these impacts can result in disparities in prevalence rates of certain mental health outcomes. For example, a UCLA Center for Health Policy research study using 2019 California statewide data found that 29.3% of California adolescents ages 12 to 17 reported symptoms that met the criteria for serious psychological distress, or SPD. The study also examined those prevalence rates for specific groups and provided disaggregated data and identified differences in these rates. For example, 42.9% of multiracial adolescents reported SPD, compared to 36.3% of their non-Latinx white peers. And the study also identified that 58% of adolescents whose family incomes were below the federal poverty level reported moderate to serious psychological distress, which was the highest among all income groups. So despite there being a widespread youth mental health crisis even before the pandemic, it's important to keep in mind that there were existing disparities in these needs. And the pandemic had a further significant impact on youth mental health, exacerbating these existing mental health needs amongst young people. A 2020 national survey found that nearly a third of high school students reported that they were unhappy and depressed much more than usual in the past month. And this trend is also reflected in the number of mental health crises experienced by young people throughout the pandemic. Data from the CDC's Morbidity and Mortality Weekly Report indicates that from March to October 2020, mental health related emergency department visits increased 24% for children ages 5 to 11 and 31% for adolescents ages 12 to 17. And this has continued throughout the pandemic. In 2021, CDC data indicated that 37% of youth experienced poor mental health during the COVID-19 pandemic. With the understanding that social determinants of health are closely tied and impact one's physical and mental health, we can examine the specific social determinants of health, such as relationships between young people and their peers, families, and communities, to understand the magnitude of the pandemic, the magnitude of the impact of the pandemic on youth mental health. It's also important to note that certain experiences, such as experiencing the loss of a parent or a guardian, emotional or physical abuse by an adult in the household, and food insecurity are considered adverse childhood experiences, or ACEs. And studies on ACEs have indicated that such experiences in childhood have been linked to negative health and well-being outcomes in adulthood. And throughout the pandemic, young people have across the board experienced sickness and loss of loved ones. They missed out on crucial social and educational connection during formative years. They experienced disruptions to their ability to access healthcare and social services, and many also experienced food and housing disruptions. Many youth were also impacted by the impact or the issues of racial justice that continued and arose throughout the pandemic. And as we mentioned before, though these factors have had a widespread impact, certain groups were disproportionately negatively affected. For example, Black, Indigenous, and people of color or BIPOC youth and their families were disproportionately impacted by sickness and loss of life due to COVID-19, partially due to overrepresentation of Black and Latinx communities in essential work that required them to continue working in person, thereby increasing their exposure to COVID-19. 20% of children who have lost a parent to COVID-19 are Black children, despite only accounting for 14% of children in the US. Due to limited internet and technology access, Native American youth, youth in rural areas, and youth in immigrant communities face challenges staying connected to friends and attending remote schooling. And Asian American, Native Hawaiian, and Pacific Islander youth face harassment stemming from COVID-19 misinformation and hate. This context of how certain social determinants of health vary in their impacts to certain communities and youth is crucial in understanding why these existing disparities exist without stigmatizing those individuals. This context is also imperative in understanding how to address the underlying needs of youth, especially for historically marginalized communities, such as youth in the foster care system. Current and former foster youth face specific factors that can impact their mental health needs, including experienced traumatic events such as separation from a parent, poverty leading to housing and food insecurity, and instability and ongoing uncertainty. Many current and former foster youth also experience harm from within the system itself. And it's also important to note that certain communities, such as Black and LGBTQIA+ youth, are disproportionately represented in child welfare systems. So these factors that can affect the mental health of foster youth also interacts with other social determinants of health, such as structural racism and stigma. And disparities are evident in other measures of mental health when comparing the prevalence rates of certain mental health outcomes of foster care alumni to the general adult population. A 2003 study found that 21.5% of former foster youth experienced PTSD compared to 4.5% of the general population. And former foster youth were also much more likely to have experienced an episode of a major depressive episode and generalized anxiety disorder than the general adult population. Because of data like this, the American Academy of Pediatrics has identified that mental and behavioral health is one of the largest unmet health needs for children and teens in the foster care system, making it imperative that current and former foster youth are not only able to, but empowered to access mental health services if and when they need them. And I know that was a lot of data to process, but there has been a growing investment in youth mental health. And there are many different treatments, resources, and supports available to current and former foster youth to support their mental health. And Nancy and Carly will be discussing how to access these services and other resources. And with that, I will hand it over to Nancy for a brief mood check exercise.
Thank you, Donna and Carly. Next slide, please. So we just shared with you a lot of data and a lot of information and wanted to kind of check in and see where everyone is. And thank you everyone for putting in your introductions and sharing with us about yourself in the chat. Really appreciate that. Now, if you could just share kind of how you're feeling right now or today, you can do so by, there are different tools that you can utilize. On top of your Zoom screen, there's a view option where you can access an annotation tool. There's like stamps or markers you can use, or you can click on an emoji so we know, give us a thumbs up or down, or if you feel happy or it could be overwhelming too to just hear so much information at once, and we wanted to acknowledge that. You can also just simply put it in the chat to let us know, and we'll give everyone a minute to do so. And thank you for the thumbs up. Thank you for the hopeful and the markers. And I see some emoji, really appreciate that. Personally, I feel hopeful, but I'm also angry at the same time, just hearing all these data, and we should do better. And, you know, even pre-pandemic, youth mental health, youth are already in crisis. And now even we all know pandemic impact everyone in different ways. And this is something that we really want to improve on. And please continue to share in the chat, and we're going to move on to the next section.
Thank you, Nancy. See if we can clear these annotations. There we go. Yeah, so next up, we're going to talk about how to actually access Medi-Cal mental health services for current and former foster youth. Next slide, please. So some questions to consider as we're walking through this material. What types of mental health services are available? Who coordinates or provides these services? How do I qualify for these services? And finally, how do I actually get these services? It's one thing to be eligible, but where do I go to get them? Next slide, please. Well, after today's session, you will be able to name the 2 categories of Medi-Cal mental health services. You will know at least one way current or former foster youth can qualify for mental health services. And if a foster youth needs help accessing Medi-Cal mental health services, you can give them at least 2 resources. Next slide, please. As we discuss how foster youth can access these services, there are a few foundational concepts that we must first understand. Next slide, please. First, what is Medi-Cal? Medi-Cal is California's Medicaid program, which is a publicly funded healthcare program that pays for healthcare, including mental health care, for children, youth, and adults with limited income and resources. Medi-Cal is available statewide. The program is jointly administered by the federal government and the California Department of Healthcare Services, or DHCS. Additionally, there are 58 counties in the state of California, which are responsible for the local administration of the Medi-Cal program. Next slide, please. Who's a foster youth then for purposes of the Medi-Cal program? Well, a current foster youth is someone who is in foster care right now. So for youth under age 18, this means that they have an open child welfare case and they are in an out-of-home placement. Or in other words, they were removed from their parents or guardians. For youth between the ages of 18 and 21, it means they are in the extended foster care program. A former foster youth then is someone who was in foster care in any state, including California and elsewhere, on their 18th birthday or later. If an individual is unsure whether they are a current foster youth or a former foster youth for the purposes of Medi-Cal, we recommend that they contact the Foster Care Ombudsman Office. And their contact information is linked here on the slide and also in the resources that we provided in advance of the session. Next slide, please. So bringing this together then, how do I know if a foster youth has Medi-Cal? Well, all current foster youth and former foster youth in California should already have Medi-Cal. The state automatically enrolls current and former foster youth into the program, and they keep their benefits until their 26th birthday. They may also stay enrolled in the program longer if they are otherwise eligible to continue to participate in the program past that age. To be clear though, Medi-Cal eligibility is not the topic of today's session. However, if you or someone you know is a foster youth and has lost their Medi-Cal benefits, or they're unsure of how to access them, then we recommend that they contact their social worker or the Health Consumer Alliance, whose contact information is linked here on the slide. Next slide, please. And then finally, there are a number of key abbreviations that we will be using throughout the course of today. So to make things easier, we wanted to consolidate those into one slide here. We're going to get into the detail of what these terms actually mean in just a bit. But for now, bookmark this slide to come back to. Next slide, please. So now I'm going to pass it to my colleague Nancy, who will discuss the types of mental health services available in Medi-Cal.
Thank you, Carly. Next slide, please. So what type of services are available? There are 2 types of behavioral health service categories. The first one is specialty mental health services. It's often abbreviated as SMHS. And the second one is non-specialty mental health services, and which is often abbreviated as NSMHS. I know there are so many abbreviations. That's why we want to highlight them for you. Next slide, please. And we're going to talk more about what each category means. So for specialty mental health services, they are provided through the county mental health plan. which we list here is often abbreviated as MHP. And the county mental health plans are county operated health plans. They provide specialty mental health services and also substance use disorder services. Each county has one county mental health plan that provides services for all its Medi-Cal beneficiaries. Next slide, please. And some examples of what specialty mental health services are, there are individual family therapy or counseling, and there can also be medication support or support during a crisis, including crisis intervention, crisis services, and also eating disorder services. There are also facility-based or hospital services, such as like inpatient services and residential programs. Specialty mental health services can also cover case management services. And one service that is recently added is peer support services. And there are also services for, especially for under 21 and foster youth that are foster care support and intensive home-based services. Next slide, please. And the second category is non-specialty mental health services. They are provided through managed care health plans or fee-for-service providers. So managed care health plans, they are privately operated health plans. Some examples are like LA Care or other privately operated health plans that contract with the state, and they provide non-specialty mental health services and other healthcare services, such as physical health services. And fee-for-services, on the other hand, they are providers who get paid by Medi-Cal for service delivered. And oftentimes they are also referred to as straight Medi-Cal. Foster youth have the option to choose to remain in fee-for-services. They are not, different counties have different populations that remain to have fee-for-services. For example, LA County, a lot of youth do have fee-for-services. The next slide, please. And here are some examples for non-specialty mental health services. They include individual, family, and group therapy, psychological and neurological testing, and also non-specialty mental health services also can cover medication support, outpatient drug and alcohol support and treatment program, and also eating disorder services. One service type that was just added this year, January 1st, 2023, was the dietetic services. They are the joint, basically they're joint screening and treatment for children and youth under 21 and their caregiver. It's called dietetic because diet is it's a term from the Greek stories, and they means two. So the child and the parent or caregiver are served as a team, basically. So that's why it's called dietetic services. And they include a series of screening, assessment, and treatment services where caregiver and youth can get support about child development and also other type of needs. And next slide, please. And so who provide specialty mental health services and non-specialty mental health services? There are two behavioral health service delivery systems, which we mentioned earlier. County mental health plans provide specialty mental health services, while managed care plans or fee-for-services providers provides non-specialty mental health services. And next slide, please. And as you notice, there were some overlaps. For example, eating disorder services, medication support, and also you can get both specialty mental health services and non-specialty mental health services at the same time, as long as the services are not exactly the same. Next slide, please. And so here, right now, we want to do some quick activity. And let me see. So bear with me when, oh, I hope everyone can see the poll. So specialty mental health services are provided through county mental health plans. Is it true or false? I'm going to give everyone a minute to put in your answer. You should be able to see it on your screen. I guess 2 more seconds and I'm going to end the poll really quick. I really appreciate the participation. Okay, I'm going to end the poll. So here. So I hope everyone can see the result that we have. Majority of people think it's true, and there are a couple people who think it's false. It is true that specialty mental health services are provided through county mental health plans. One way to kind of think about it, because when I first learned about the different terminologies and different services types, it's very confusing. So one way for me to think about it is the county mental health plan, they have the responsibility and opportunity to provide specialty mental health services for youth. So next slide, please. We have one more question right now. And so true or false? You cannot get specialty mental health services and non-specialty mental health services at the same time. And Sam, I'll give people a couple more seconds to enter, put in your answer. So the question is, you cannot get specialty mental health services and non-specialty mental health services at the same time. Okay, so I'm going to end the poll right now and also share results. And we have majority people answer saying that it's not true, and a couple people saying that's true. So the answer is, it is false. It is not true, because yes, you can get specialty mental health services and non-specialty mental health services at the same time. As we talked about earlier, there are some overlap services, but the purpose and the service types are mostly different. And even for example, the overlap area, eating disorder, there are different, as we probably know, there are different array of services that are needed to support someone with eating disorder need. And so the answer is yes, you can get both service type at the same time. And next slide, please. And just a quick reminder of what these abbreviations are. The specialty mental health services are provided by the county mental health plan, MHP, and the non-specialty mental health services are provided by the managed care plan or fee-for-service providers. Next slide, please. And I'm going to hand it off to Carly.
Thank you so much, Nancy. So next we're going to discuss how a foster youth can actually qualify for these services. Next slide, please. So as Nancy discussed, there are 2 categories of mental health services available through Medi-Cal: specialty and non-specialty mental health services. The access criteria for these 2 categories is different. Additionally, the criteria is more lenient for individuals who are under age 21. So let's dive into these different standards. Next slide. So first, let's discuss how to qualify for specialty mental health services if you're under 21. So there are 2 different ways to qualify for these services. The first is that you have a mental health disorder, a suspected mental health disorder not yet diagnosed, or you have experienced trauma that puts you at a risk for a mental health disorder in the future, and your mental health condition negatively impacts important parts of your day-to-day life or is likely to. Next slide. Thank you. Or, I know this is complex, so bear with me. You are at a high risk for a mental health disorder because you have experienced trauma, as evidenced by any of the following: scoring high on a trauma screening tool, involvement in the child welfare system, juvenile justice involvement, or experiencing homelessness. So this second way of qualifying for specialty mental health services as a young person was just added last year in January of 2022. It is a component of California's CalAIM initiative, which consists of wide sweeping policy changes to improve equity, coordination, and person-centered care within the Medi-Cal program. What this expanded access criteria really means when you break it down is that if you are involved in the child welfare system, then you are presumed to be at a high risk for a mental health disorder, and thus you are automatically eligible for these services. So now that might raise the question, what does involvement in child welfare mean? So next slide, please. The state has released policy guidance that has said involvement in child welfare means that you have an open child welfare services case, meaning you're either in foster care or out of home care, or you have a family maintenance case, whether that's pre-placement or post-reunification. So notably, this includes both court-ordered involuntary agreements, both in-home and out-of-home placements, and also if you've been adopted through the child welfare system. And I know I saw a question in the Q&A in the HUVA that related to this. So if you have been adopted through the child welfare system, you still are considered to be involved in child welfare, meaning that that will then qualify you for specialty mental health services if you are under age 21. So the definition is rather broad and expansive, with the purpose to be more inclusive of foster youth and really meet their needs. Next slide, please. So what if you are 21 or older? Well, the criteria is different in that case, although it still does not require any sort of mental health diagnosis. So if you're age 21 or older, California law says that you have the right to access specialty mental health services if you have a mental health disorder or a suspected one not yet diagnosed, and your mental health condition negatively impacts important parts of your day-to-day life or is likely to. So while not as expansive as the criteria for individuals under 21, I do again want to emphasize you do not need a diagnosis to access mental health care, even if you're 21 or older. You only need a suspected condition that is negatively impacting important parts of your life. Next slide, please. So what about non-specialty mental health services? Which, to review, are the services that are provided through your managed care plan or fee-for-service as opposed to your county mental health plan. Well, non-specialty mental health services have different criteria based on your age as well. So for those under 21, they have a right to access non-specialty mental health services if they have a potential mental health disorder that's not yet diagnosed, or they need the services to sustain, support, improve, or make more tolerable a mental health condition. An individual need only meet one of these prongs in order to have a right to access services. And notably, this second prong incorporates what's known as in federal law as the early and periodic screening, diagnostic, and treatment, or EPSDT standard. Next slide, please. If you're age 21 or older, the criteria is slightly different. If you fall in this age range, then you have a right to access non-specialty services if you have a potential mental health disorder that is not yet diagnosed, or you have a mental health condition that is causing distress or negatively impacting important parts of your daily life. So at this point, your mind is probably swirling with a number of different standards. And if you're anything like me, you might be having trouble keeping them straight. So let's review. Next slide, please. This chart summarizes the different standards for accessing mental health services through Medi-Cal. And these are outpatient mental health services through Medi-Cal. So starting on the left side of the chart for specialty mental health services, regardless of your age, you have a right to access services if you have a mental health disorder or a suspected one and it negatively impacts your daily life. Additionally, if you're under 21, you have a right to access services if you're at a high risk for a mental health disorder because of trauma, including simply because you've been involved in child welfare. So moving to the right side of the chart then, Regardless of your age, you have a right to non-specialty mental health services if you have a potential mental health disorder. Additionally, if you're under 21, you have a right to access services if you need those services to improve your mental health condition, or if you're 21 or older, you have a mental health condition that causes distress or negatively impacts your daily life. So that's the summary of a rather complex set of legal standards for accessing Medi-Cal mental health services. And if you're interested in diving deeper into any of these access standards, I have included the relevant legal citations at the bottom of each of the previous slides. So please feel free to check that out afterwards. Next slide, please. So let's pause for a knowledge check. So let's see, true or false? You need a diagnosis to get mental health services through Medi-Cal. True or false? I see some answers coming in. A few more seconds. Okay, final call. Okay, looks like most of you said that that is false, that you do not need a diagnosis, and that would be the correct answer. In case I haven't said it enough, you do not need a diagnosis to get mental health care services through Medi-Cal. Next slide, please. One final knowledge check. If I am under 21, then I can qualify for specialty mental health services because I am in foster care. Is that true or false? If I'm under 21, then I can qualify for specialty mental health services because I am in foster care. True or false? A few more seconds. You all got it correct. So this is true. As we discussed, involvement in child welfare creates a presumption that you are at a high risk for a mental health disorder. So under the new criteria established pursuant to the CalAIM initiative, that means that you qualify for services because of this inherently traumatic experience. Next slide, please. So now I'm going to pass it back to my colleague, Nancy, who will discuss next in practice how you can actually get services.
Thank you, Carly. Next slide, please. So how to actually get Medi-Cal covered mental health services. For specialty mental health services, you can contact your county mental health plans. And here we include a link to a list of county mental health plans. I think contact numbers and also their website. For non-specialty mental health services, you can contact your managed care plans, which we also included a link on the slide. Or because not everyone has a managed care plan, you can also look for a fee-for-service providers by calling the healthcare options at the number listed here. Next slide, please. And so what if you don't know whether you need specialty mental health services or non-specialty mental health services? Contact either the managed care plan or county mental health plan for an assessment. California has a no wrong door policy. So if you contact, there's no wrong place to contact. If you contact one place and that you might need, but you might need services from the other plan, then they will refer you to the right place. And what if you don't know whether to call managed care plan or fee-for-service providers? You don't know if you have a managed care plan. Contact the social worker, your child welfare social worker, or the county's Medi-Cal office. You can find out more. But what if you're totally lost and overwhelmed, even as providers? As a formal provider myself, and it's totally possible to not know where to start. It's okay. As I say, there's no wrong door. We do advise you to contact the county mental health plan first, just to start. But really, there's no wrong door. Next slide, please. And so today's takeaways. as you probably remember, we set some learning objectives. So we really hope that you remember, if anything, that there are two categories of services: non-specialty mental health services and non-specialty mental health services. Specialty mental health services are provided by county mental health plans, and non-specialty mental health services are provided by managed care plans, if you have a managed care plan, that is. Or non-specialty mental health services can also be provided by fee-for-service providers. It's possible to get both specialty mental health services and non-specialty mental health services at the same time. And also, as I shared earlier, if you're not sure where to start for yourself or for your youth, contact the county mental health plan first. And they will refer you to the place that's needed. And the second point we really want you to take away from this session is that foster youth can qualify for Medi-Cal mental health services for being involved in child welfare system. And a mental health diagnosis is not needed to access mental health services through Medi-Cal. Next slide, please. And Carly, please take it away for the resources.
Sure, thanks. Next slide, please. So first of all, thank you all for being here. To conclude, we wanted to provide some helpful resources to learn more and some materials that are actually geared towards foster youth that we encourage you to distribute. So again, we want to uplift the youth-facing materials that NHeLP and NCYL have recently developed. We encourage you to check out these links and share them widely. Next slide, please. We also wanted to uplift a few key external resources for youth who may need help navigating this incredibly complex system. The first is the Family Urgent Response System, or FURS, which provides free 24/7 support on issues big or small to youth who have spent any time in foster care. Second is the Foster Care Ombudsman. If a foster youth has any questions or would like to file a complaint about their placement or child welfare services, this is the office to contact. And then finally, if you have any questions at all about Medi-Cal services coverage or eligibility for an individual, then contact the Health Consumer Alliance, who can provide free legal help on those sorts of issues. Next slide, please. So I guess that concludes our prepared portion of our session today. And we welcome any questions. Please add your questions to the Q&A in Huva. I'm still learning how to pronounce that the right way. And yeah, thank you.
I think there is one question here for you, Carly and Nancy. I see someone asked in Huva, how do you get the dietetic services for family members?
I can take that. So dietetic services are for the child and caregiver or parent. You can contact the managed care plan for the services, but it also, because it says family members here, so it also depends on your relationship. Is it a child? Is it someone in your care? Or but if you have, usually it's caregiver who contact the managed care plan. But the short answer is contact the managed care plan and find out more. And even that applies even if you're a provider, you wonder how your client or the family you work with can get services, that would be a place that you can advise your family to contact, or you can contact or advocate on their behalf to find out more.
Great, thank you, Nancy. And again, we encourage folks to ask questions in Huva. But as folks are thinking of potential questions to ask, we do have some case scenarios that we can go through. So for this first scenario, I work with a 19-year-old who is a non-minor dependent of Los Angeles County. However, the youth now lives in Riverside County. The questions to consider today are, can the youth use the information in your guide? And should the youth contact county mental health plan in Los Angeles County or Riverside County? And I will pass it to Carly and Nancy to discuss.
I can take this one too. So it's very common for youth to be placed outside of the county of the child welfare jurisdiction. So this question can also apply to other counties. And so can the youth use the information in our guide? The guides that we're talking about is the resources that we shared earlier that NHeLP and NCYL had published, and the information includes all Medi-Cal covered services. And so the answer is yes. The youth is still within California, so the youth can certainly use information in our guides. And so the second question, should the youth contact county mental health plan in Los Angeles County or Riverside County? In this case, usually the Medi-Cal County would be the county of residence. So it would be the Riverside County Medi-Cal County mental health plan that the youth should be contacting. However, the youth can also contact the child welfare social worker in LA County, the caseworker, to find out more. But for the purpose of the second question, it would be Riverside County.
Thank you, Nancy. And I do see we have another question from the chat. How do providers determine whether a mental health disorder is negatively affecting a young person's life?
I can take that question, and Nancy, if you have anything to add. So this would be a fact-specific inquiry. A provider would really inquire about the major life activities of the individual. So for example, are they having trouble caring for themselves? Are they having trouble concentrating? Are they having difficulties in school? Is their functioning, their day-to-day functioning impacted to a level where there's a noticeable difference? And is that condition, is that caused by whatever mental health condition is happening, whether that's diagnosed or not? So it's kind of hard to answer without coming up with like a very specific example. But again, you would look at the major life activities of that individual to see how they're functioning.
Yeah, just also to add, this is almost a clinical question. So if you have, say you're not a clinician, your job is making the diagnosis or assessment, definitely refer the youth if you feel like the youth might have some need for services, and the clinician can make the determination.
Thank you, Carly and Nancy. We do have another case scenario for discussion here. I am a 23. Actually, we do have another question that just came in the chat. So to prioritize folks' questions, this one is, are there requirements for staff of STRTPs to have training in mental health care? Not the clinician that comes in for group therapy, but the actual staff that are with them daily.
I want to say yes. It also depends on the agency, but that's a question we can, if you have specific agency or STRTP in mind, we can take it back. But the best practice is everyone who have contact with the youth should have some kind of training. And because mental health care, training on mental health care is also kind of vague. So it depends on what kind of training and how in depth the training goes. So I hope that answered the question. Do you have anything else to add, Carly?
No, I don't. Thank you, Nancy.
Thank you, Nancy. And I think we have a few minutes left so we can discuss this case scenario. I am a 23-year-old former foster youth. I have Medi-Cal. I have never attended therapy, but I think I need help now. And the questions for discussion today are, do I need diagnosis to qualify for mental health services? How quickly can I get an appointment? And what if I don't like the therapist I'm assigned to?
I almost almost feel like we should poll the audience for some of these questions. So, I mean, they answer the first question, as I hope this is one of your big takeaways from today. No, you do not need a diagnosis to qualify for mental health services. I'd look back at the chart that we put together, the flow chart in terms of looking at their age. Okay, former foster youth, how do I qualify for services and what is the standard of proof there? How quickly can I get an appointment? It depends if it's an urgent or a non-urgent appointment. So generally, if we're talking about specialty mental health care services, which you receive again through the county mental health plan, an urgent appointment, they have to give you one within 48 hours or 98 hours if prior authorization is required. If it is a non-urgent appointment, including if it's a non-urgent new or a follow-up appointment, then they have 10 business days from your request or the date of your last appointment to get you in. And then what if I don't like the therapist I am assigned to? Know that you can change providers. You can change providers as many times as you would like. And you should call your county mental health plan or your managed care plan for non-specialty services to ask for options. And, I'll speak from the I for this. I myself receive mental health care services, and it took me a while to find a therapist that I clicked with. So it's okay to say that this isn't working for me and I'm going to look for someone else. That's very normal. And I understand the process is very difficult because there aren't enough mental health care providers out there in California right now, but call, ask, keep trying. I don't know, Nancy or Donna, if you have anything to add.
Yeah, appreciate you sharing, Carly. I just added a response to the chat. I know one of the common challenges is the time that it takes for assessment or services, and also find a therapist that you click with. And yes, definitely keep trying. And there are legal requirements for, like, for example, the timeline that a youth or a person should be getting a assessment or appointment, follow-up appointment. And if you have any questions or any help, we have a list of resources listed in the guides and also in the slides. For example, the HCA, they provide free legal assistance to people who need help with accessing healthcare services. So please utilize these resources.
Great, thank you, Carly and Nancy. We have 2 minutes left, so opening it up for last minute questions from folks. But we also want to say before we end today's session, thank you again for joining us today. And again, my name is Donna Pykow, and you can reach me at this email. And I wanted to give Carly and Nancy some time for any closing statements.
Just thank you from me to everyone who joined, and thank you for your work and advocacy for the youth. And if you are youth, thank you for being here and learning more and your skills and advocacy work as well. Thank you.
Yeah, thank you so much, everyone.